Okay, now on to our Health Watch. This month is Lung Cancer Awareness Month. Right now, it is the third most common cancer found in the United States, and it is still the leading cause of cancer deaths worldwide, which is especially unacceptable because lung cancer is so eminently treatable. You just have to find it in time. This morning, I'm so happy to be joined by Dr. Anil Magge, the Director of Interventional Pulmonology with Trinity Health of New England. Thank you so much for joining us,
Thank
Doctor.
you for having me today.
Yes, glad to have you here. I was trying to soak up all the knowledge about lung cancer that you were able to give me right before we came on the air. But yeah, first and foremost, we have to talk about screening. Who should be screened and when?
Yeah, so great question. Thank you for having me and focusing on such an important topic. It does affect a lot of people.
Yeah.
So who should be screened? Really, the biggest population that we need to screen are patients at risk who are smokers. So the United States Preventative Service Task Force came out with guidelines several years ago. It's been modified a couple years ago.
Right.
Patients of the age 50 to 80 years old who are current smokers or who have quit within the past 15 years and that have at least a 20-pack year smoking history. So 1 pack year is 1 pack per day for 20 years.
Okay.
So these are the individuals that need to be screened. And the reason why we should screen them, just like how patients get mammograms or colonoscopies, if we can find spots that are concerning, we can then evaluate them by doing a procedure to biopsy them, and then if it is a cancer, then send them for a curative treatment, whether it's surgery or radiation.
So what does the screening look like? How involved is that process?
It's actually very simple. It's a low-dose CAT scan. So it's slightly, it is a CAT scan, but it's not as much radiation.
Right.
So it's very simple for a patient to get.
How long does it take?
The scan will take a couple minutes. The whole process of going to radiology, getting the scan, could be about 30 minutes.
How often is it covered by insurance? Do you know off the top of your head?
Yeah, it is covered by insurance, and that's why we really want our patients to get it because it can be so helpful.
Yeah.
And patients that even don't have insurance, there are ways to get this covered.
Just personally, I feel like I've heard a lot more about that screening. People are trying to get the word out a lot more than they were in the past. So I'd love to learn more about that. But I do want to talk just about the types of lung cancer there are. What are we looking at with survival rates, and how much better do those survival rates if you catch it early before it spreads?
Yeah, so there are different types of lung cancer. One type is called non-small cell lung cancer. The other type is small cell. They're completely different in terms of the genetics of the tumor.
Yeah.
In terms of lung cancer survival, we are now detecting it earlier. The American Lung Association just came out with recent data, and specifically in Connecticut, we are catching it a little bit earlier, which is really good.
Yeah.
So that means that patients, if we can diagnose them earlier, they tend to have a better outcome, and that's what we're looking for.
And for people who do wind up, on that scan comes through, you do a biopsy, you find cancer, what are the next steps in that process?
Yeah, and I think that's probably the scariest part, is once you're diagnosed, what do you do next? Luckily at St. Francis Hospital, we have a very good team, and it's a team approach when we take care of patients with lung cancer. So not only do they meet me where I do the initial biopsy, if it is a cancer, I communicate closely with the thoracic surgeon, the oncologist, and potentially a radiation oncologist, and we coordinate all the appointments so that the patient will see these doctors and physicians very quickly and streamline the process and get them through this very safely and quickly.
Last question, real quick. Do we know what percentage of lung cancers wound up being because people were smoking or just not taking care of their lungs in a way that they should?
The vast majority is due to smoking. There are a smaller population of patients that don't smoke, that they're young, that do end up having lung cancer, but it's much rare, but I do see it often, unfortunately.
Yeah.
So if we can stop smoking, get screening done, I think these are the right steps in the right direction of detecting lung cancer early.
Yeah, and given how many people die from lung cancer, we can make such huge strides in longevity just by tackling this big problem with some common sense things. Screening is always the good way to go. Dr. Magge, thank you so much for taking the time.
I appreciate you having me today.
Yes, I appreciate your knowledge and your wisdom and everything you're doing with people who have lung cancer there at Trinity Health of New England and at St. Francis. We appreciate it.
Thank you.